It is really an honor to be here with you today to talk about a topic that I think is crucial, yet oftentimes underappreciated when we think about the tools that we have available to help achieve our collective goal of health equity. You know, in today's connected world, media doesn't just reflect society, it actually helps to actively shape it from the social media that we're scrolling through all day to the digital and print advertisements that are served to us at the most influential points in our lives. Uh, these messages we receive from media really play a pivotal role in influencing how we perceive health, how we access care, and how we shape our and manage our own well-being. And this power is undeniable. And in healthcare, it can oftentimes be a matter of life or death. I mean, think about it. In an era where misinformation can spread faster than the facts, the ability to deliver accurate, clear, and inclusive healthcare information is more crucial than ever. The right message delivered through the right channel can empower communities to take control of their health. It can inform people about the available resources, dispel myths, and inspire action, especially among vulnerable populations who might not otherwise have access to this information. So, you know, that's all great, but let's be honest. Traditional healthcare information and messaging often falls short of this goal. It can often be too clinical, too far removed from the everyday experiences of the people it seeks to serve. Um, and this is where media has the potential to become extremely transformative. When used effectively, media can bridge the education gap that exists. It offers a platform to speak directly to people in ways that resonate with their realities, cultures, and experiences. So today we're going to delve into uh, how we can assess and harness the power of media to ensure healthcare messaging is not only effective, but also inclusive, and perhaps even more important, how can media help us turn the tide on health disparities and inequities? So the answers lie in how we approach healthcare communications moving forward. So I am really excited to introduce our subject matter experts today who is going to join our panel. And if I kind of think to what Enrique mentioned earlier and think to my inner child is telling me, wow, these are some really fancy people that are coming up here. Um, so without further ado, yeah, I would say it that way, by the way. I was kind of a geeky child. So, but the cool kids, now we're the cool kids, right? So, without further ado, please join me in welcoming Stephen Farquhar to the stage, Chief Executive Officer of Publicis Health. Stephen leads a team of healthcare marketers and communications experts across a diverse portfolio of agencies, including Digitas Health, Heartbeat, Langlard US, Payer Sciences, Razorfish, and Sachi Wellness. Welcome, Stephen. Please join us on the stage. We also have Melissa Gordon Ring, Global President of Health at IPG Mediabrands, where she oversees a global portfolio of major pharma brands. And Melissa has worked across the healthcare space for much of her 20-year career in advertising she's young, with extensive experience across 20 plus disease states. Welcome, Melissa. Testing. All right. All right. So we're going to start with a question to just kind of ground us all on media. and how media companies play a role in helping to dispel disparities in healthcare and achieve health equity. So, Stephen, I'd like to start with you. Tell us, what are the role of media companies as stakeholders in addressing health equity?
Thank you, and thank you for inviting us here today, Enrique and team. It really is a privilege to be here, and we're not that fancy, by the way. First of all, I certainly don't feel fancy.
But that look at that accent.
I know the
That's
accent.
fancy.
The accent's, at least. But there's two parts. One is I think I should, sitting here and talking at a diversity conference or an equity conference and being a middle-aged white guy from the UK. I do recognise that there's either an irony in there or there's certainly a check my privilege. But I think, as I was saying to Steve earlier, if we're not on this journey with everybody to drag this into the mainstream, then who is? So like. And so I really want to acknowledge that because this morning was inspirational for me. Secondly, some people might be thinking, what the hell do these people do, right? They're in charge of, and we're a big part of, both of us, Melissa and I are both part of massive marketing conglomerates. There's only about 5 or 6 in the world. We take a number of the healthcare corporations that are here, we take their marketing budgets and we invest them. We invest them in TV networks, we invest them in Facebook and Google. We can't obviously report on how much we invest on behalf of healthcare corporations, but reported is about $8 billion a year for my company. It's probably not dissimilar for Melissa's company. So with that comes a huge degree of commercial influence, but also a huge degree of responsibility as to where we're investing that money. And that's one of the things I think we want to get into today, Steve, is like, what do we do about that? How do we advise clients better that some of that should be spent in areas that are for more marginalized communities, because that's an awful lot of money, and we do a lot of initiatives in that time. We spend hundreds of millions of dollars on what we'd class as inclusive buying audiences to make sure that we are we are investing with minority-owned channels or networks, minority-targeted channels or networks. But I would say, back to some of the points that Enrique's raised in the past, is it's still a percentage point. And it's not actually the main it's not the main nub of what we're actually achieving with that $8 billion spend each year. And so I think the job that we have is to make sure we're doing the hygiene, to make sure we're actually doing some of the things that are, to make sure we are bringing, suppliers into it, make sure we are targeting the right communities. But I think there's more to be done with our clients, who are some of the people in the room today as well, to show them that mission and margin can be mutually compatible. I love that phrase from earlier, no margin, no mission. But we can show the value to bring along some of the communities and some of the audiences that can be as commercially viable as some of the other ones they do. Because what happens, and I'll talk about this a bit later as well, is that at the basis of any great marketing plan is an audience segmentation. It's your addressable market. And then you have to look at your different audience segments, and then you prioritize. And normally you prioritize according to the commercial value that will be returned. So we have to bring the mission with the margin, we have to prove that the segments that we want to talk to are the same segments that will bring commercial viability to that company in the future, and that's what will bring sustainability. So I think it sounds like an easy job on paper, but I think what we're trying to do is make sure that we can educate as much as possible within major corporations.
Wow, thank you, Stephen. And I think it's really insightful, especially as you think about some of the data that is out there. There are statistics that tell us, right, in the U.S., about 40% of the general population is diverse, yet only about 5 to 6% of media dollars in our ecosystem are going to diverse-owned media channels.
Yep.
Right? And so the work that you're doing is directly affecting and inspiring companies to invest equitably in reaching diverse communities. Melissa, do you want to chime in?
I'd love to, actually, and it really is such a great privilege to be here today, and a privilege to work with so many different healthcare marketers to help them deliver on their goals of really helping people live better lives. When it comes to data, though, it really becomes incredibly challenging. To Stephen's point, the algorithms are always going to point us in the direction of the greatest return on investment. And right now, in the world of healthcare, outcomes move faster with more, with white populations. That's always where we're going to be pushed in terms of the algorithms to drive ROI. So we have to be really thoughtful in how we report and how we measure, because it's that measurability point that makes such a tremendous difference in actually showing success. So especially when we're working with different types of partners, right? It's not a level playing field, and we have to help our larger partners in evangelizing and promoting partnerships with these larger, these bigger companies to smaller companies within the BIPOC space that have really small but very critical and important audiences, to help them and give them a little bit more privilege in terms of access, as well as this idea of true measurement and what does that really mean, and giving them greater connectivity to some of the data sources that make so much of the decision making in the world that we live in on the advertising and data and technology side, so that we can actually measure the true impact of working with these types of partners on the audiences that need it the most.
I love that. Especially when you think about our organizations and how we're all saying we're data driven, right? The way we influence our investments is through data. Yet when we think about how we can look at the marketing funnel, right? It's really hard to track in that marketing funnel how we're driving these diverse patients all the way from awareness to actually getting them on therapies, and keeping them on therapies is just as important, right? The persistence, and looking at the social determinants of health data sets and overlaying that to really get an overarching understanding of where are the places and spaces that we can make impact. Fantastic. So, Melissa, I'm going to send the next question to you. So, in a world where cat videos go viral faster than flu shots, how can media companies keep healthcare messaging valuable, transparent, and equitable while competing to capture attention with these viral cat videos?
I love this question, because the reality is that attention and time is the world's most precious non-renewable resource, right? Like, there will never be a 10 minutes to 2 on Thursday, September 26th ever again. And we have to make sure that there is value in the exchange of that time. We have to also make sure that when it comes to targeting, to your point, that the message makes sense to the person that we're serving it to. And that's not just a patient, right? Because the entire patient journey, the healthcare continuum, really involves so many different key stakeholders. And on our side of the business too, it's incredibly critical to ensure that we are messaging our HCPs and our healthcare professionals in a way that also makes them truly understand the impact that they have for a certain audience, and that then marries well with the messaging that we're sharing with consumers. So ensuring that we're in the right spaces, in the right places, with the right tone, with the right call to action, to ideally contribute to better health outcomes. And we've actually even seen that in some research that we've done around demo matching. And I was so excited when the gentleman was talking earlier about the project with the Cherokee Nation, and how you really, teaching within the community had true impact and long-term impact in that community. And we've done some research on the changing face of HCPs as we think about what the doctors look like today are not going to be the doctors of 5 years from now or from 10 years from now, and how there is also better actual outcomes, physical outcomes, as a result of pairing patients with physicians that look like them. So it comes back to the message, it comes back to the thoughtfulness and the care and the strategy in how we can truly deliver messaging that people are open to at a time that is most critical for them, with next steps and a clear roadmap for the future.
I think it was. Do you mind if I?
Yeah,
I don't
please
know.
chime in.
I'm not very good at the protocol of panels, but I thought that was a
No,
great
no.
point,
Please
Melissa.
chime
That
in.
was, three amazing things. Dr. Leppert, Dr. Shaya, Dr. Lopez today. There's a prevalent theme. The treatment that you get is contingent upon the amount of empathy and understanding that the physician can convey or that healthcare system can convey. And that amount of empathy and understanding comes uniquely from, I think, cultural background and understanding the cultural nuance that comes with that. And unless we do something about that, I mean, that is a medium and a channel in itself for better care, better engagement with medical systems. And as much as you might not think that's a question for a media agency to answer, it is. What Melissa's talking about is the amount of investment we put into making sure that physicians are more representative of the people they're actually caring for, right? If you look at the basic demographic facts of it right now, I think, let's say 20% of the US identifies as Hispanic, yet less than 7% of the physician community is Hispanic. 13% for the black community overall as a American society, less than 6% of all physicians are black. We're not dealing with it in that way. We're also in a place where in a decade's time we could be 125,000 people short, 125,000 physicians short in the US. What are we doing about that with the corporations that we do to try and not only create, I think, a pathway for people to become physicians in a way that's much more representative of society, but how are we actually making sure that we're educating the physicians that are currently there to actually deal better with the cultural nuances and the different backgrounds that we face? And that's a huge thing for us in the future. Am I allowed a second point to that question?
Yes, please.
Do you mind? Because
Please
it's
go
a
ahead.
different point, but it's an equally critical path. Another thing that kept coming up today, and I've heard it a lot, is that your zip code is much more of a determinant of your overall health
100%.
outcome than your genetic code, right? The biggest shift in media as us, as practitioners in the past 25 years is we can target everybody by zip code now, right? We can talk to people on a zip code level. And I don't mean 25 years ago that would have been a direct mail piece, a letter that goes to your house, right? Now you can have broadcast television at a zip code level. You can have Facebook and social.
Zip plus 4.
Yeah, sorry, and Melissa's probably much better technically than me at this stuff. I just get carried away with the possibility, I think. But you can target what you'd think of as a multimedia, high-level brand awareness campaign at a zip code level. And when you talk about the relevance of the messaging, like the power of the messaging, that's when it gets really interesting, because at zip code levels, the need for different levels of communication, the different messages are going to be the thing that's powerful there, right? For some people, it's just education of the condition in the first place. Others, it might be that it might be affordable for them. Others, that there is a way to get this, even when you think you're disenfranchised from the community or the medical kind of ability, financial ability to actually get that, right? It might be more basic messaging in that way compared to what you've said, Melissa, which is, as you say, the algorithm always predicates on high-value actions in the white middle-class communities. That's a different message, right? That is a very different message from some of the more fundamental things that we need to do. And again, we're quite carried away with this notion of zip code level targeting or very granular targeting, but I don't see it come through in the change in messaging that we need to do to make sure that everyone is served properly.
Wow, very insightful. Thank you. And it's clear that all of this is a lot more complex than it might seem on the surface, right? That's why we need so many experts dedicated to understanding these algorithms and how we may be able to structure content in ways that it gets delivered to the right people at the right times. Now, talking about algorithms, I'm going to start with you, Stephen, for this next question, actually. Trust. Let's talk a little bit about trust as a foundation of healthcare, especially among diverse communities. And we talked a little bit about the era of misinformation. So how can we combat misinformation and disinformation in an era that is increasingly dominated by artificial intelligence while rebuilding trust in these communities?
Yeah, I think with anything like this, that such rampant new technologies give a cause for complete pessimism and complete optimism in equal measure. And I think it's right to be sort of vigilant about both. When I wake up at 3 a.m. on a cold, dark night and I think about artificial intelligence and I think about Facebook or I think about Elon Musk, and I think that, what Dr. Lopez said about us as a sort of institution is correct, but also AI is a racist structure. You know, it is made and built on data sets that were created by humans. It is the pool of our humanity. And when you look at humanity, it's not always the best, right? And I think there's already a whole pool of biases in what AI creates. Our social platforms are engineered to enable and amplify and accelerate and augment some of the most sort of egregious messages out there, right? They are. Anything that is clickbait tends to be more egregious. And on a non-machine level, I think the pernicious force of health and wellness influencers who aren't FDA regulated, some of them are good, many are well-meaning, some of them are dangerous to actually what is going to be, you know, good cause for getting proper medical care. And I think we have to be very careful. I'm not saying all of them, but I think there's enough of them that makes sure it is a place to watch. At the same time, you know, we can make sure we combat some of these things. A lot of the conversations we have at a social media level are around who to invest in and what does that do and your brand safety in that place. And I think that is a tremendously worthwhile subject because, you know, it's not just about our own views, it's about the views of people that we actually serve with these ads. But I think there's such a cause for optimism at the same time in things like AI. If you think that what I talked about before, how do you educate people on getting the help that they need? In over 1 in 5 households in the US, still English is not the first language. Some people still rely on other family members to be translators for them when they go to the healthcare system. If you think what AI can do, one of the most basic use cases is automatic transcreation and translation into 150, 200 different languages of all the most kind of like profound medical kind of education. That's a start. That's a really good start. If you start to take things like that, if you think about some of the things that Dr. Martez Smith, I think it was this morning, is it? The first thing he talked about the sort of cultural taboos around sort of sexual health education and everything like that. AI is a great place to start with that. If it's an anonymity that you want when you want to consult on sexual health because you feel embarrassed or you feel there's a taboo attached to what you do, what better place to actually start than in the relative anonymity of technology? So there's other places I think that we can actually apply really wisely. Am I going to solve the misinformation crisis today caused by a lot of social media? I don't think so, but we can try at least to make sure we make a dent.
So I just want to build on that for a minute because I think that there is definitely opportunity for good with AI, 100%. But we also have to be really careful, especially in the world of healthcare, because there is nothing that is going to be as poignant as the voice of a true patient. And when we're utilizing AI for speed and understanding, that's absolutely incredible. But we also have to be very careful in the world of search, where people are utilizing AI and ChatGPT as a search engine, and there is no oversight or legislation right now that is actually saying that what is going to come back to them is real information. So then we have to deal with misinformation, and then following that and ensuring that there is honesty in the communication that people have coming out of that is a really critical thing. The other thing is we have to harness the power of data for good. We truly need to be able to utilize data in a way that helps us identify, on top of zip codes, ways that we can actually speak to people that resonates more than traditional ways. We talked a little bit too earlier, like in our earlier conversations around privacy, right? So the world is continuing to introduce all different types of privacy law and legislation. In the United States, a number of different states are bringing policy into place that is inhibiting our ability to actually target people based on race. So in essence, it's supposed to help protect people, but where we're trying to ensure that we hold ourselves accountable and overreach and invest and overinvest where we can to level that playing field and make it a more equal playing field, we are now being restricted in our ability to do that in states that actually represent 50% of the BIPOC population. So we have to be very careful in terms of what we stand behind and what we can do in terms of the field that we live in, and in service of our clients and our patients and people overall, that we're utilizing privacy and data in a way that is helpful and helps move us forward. Because if we do our jobs well within this world and in healthcare, and we provide equity, then we're giving people the feeling of a little bit more of control of something that they don't have control over, whether that's a patient or a physician. Options feel like control, which can be, empowering. And that has to be done for every single one of us.
Thank you. Thank you, Stephen and Melissa. Really great insights. And as you have talked, it just really clarifies in my mind how important it really is to utilize media as a tool to drive the right information and what kind of impact that has on people's health. I mean, you're searching. Oftentimes, we try to be our own doctors before we go to the doctor, right? WebMD, all of these places. And with artificial intelligence on top of that, it's easy to go astray. So thank you for those insights. So thinking about partnerships and media's role, health equity takes a village, right? Who do we need to invite to the party? In your view, what partnerships and collaborations are crucial to making real and lasting progress as you think about media as a tool to help strive for health equity?
Me?
Either of you can take it. Melissa,
I'm
please.
happy to. I think partnerships can be defined in a lot of different ways. If anything, sometimes it starts with a handshake or a hello or even a LinkedIn introduction. We've done a lot about challenging our clients and our partners to find someone that doesn't look like them or doesn't provide a service that they provide. And there really is no wrong no wrong partnership, and that a hand held out is a welcoming and an openness to collaborating on something new. Because when you start to do that, you do build trust, and trust truly is one of those huge things that we talked about, and it's built in increments. I joke that's my favorite quote. I said it earlier too. But when you start to build partnerships, especially with people and entities and organizations that that you can help, those partnerships become even stronger.
Love it. Would you like to chime in, Stephen?
I've always got something
Oh.
to say,
Okay.
Steve.
All right.
Look, I think if you work for a pharmaceutical healthcare company in this room today, I would say I'd like you to think, because I love the notion of everyone saying, like, what's the one thing we can take back and what can we do from this, right? Because it's about action. I'd like you to go to your marketing department and ask to see their audience segmentation for some of their major drugs or products that are going on there, and start to look at the segments in which they're not actively targeting and why that might be. Because that's the ones I'd like to get involved in and say, I want to turn that around. There's one recently that was multiple myeloma diagnosis data that was 50% of those diagnosed with it don't actually receive treatment. And it can't all be because there's not adequate insurance, or there's too late stage to actually be. There has to be a sizable segment in there that just doesn't understand they can get the means to actually help them, right? That's one really personal example to me that I thought we have to go there, right? And I know that it sounds clinical to talk about audience segmentation, right? Or it sounds a bit theoretical. It's not. It's how people choose to place their budgets, and it's billions of dollars. Remember, it's not hundreds of thousands, right? It's billions of dollars, and it's how major corporations prioritize their budgets according to the people they're going after. And I think that for us, the most basic thing we can do is start with a segment that's been overlooked, but that we believe should be receiving that treatment.
Wonderful. All right, I have one more question for you. I promise it's the last one. So as we leave the discussion today and we're thinking about media, what are the most critical shift? What is the most critical shift you think that digital media needs to make to communicate healthcare messages effectively and reduce health disparities and foster long-term trust within marginalized communities?
I'll go first
Go
because
ahead.
it's back to, I'm going to reprise the part about zip code targeting, right? As I said, as an industry, we get high in our own supply of like granularity of data, audience targeting, personalization at scale, which is like, it's great because it can be done. I just don't think it's done enough. And I think that the zip code's one element, and you're right, Melissa, there's more elements to it than that. But we can start to, if we understand where people live, we can understand what the barriers are to their getting adequate healthcare provision. And digital allows us, as I said, the chance to actually communicate empathetically and powerfully with them to get them to the right level of healthcare provision. That is a pivot that wouldn't have been possible 25 years ago, and I don't think we make enough of it yet properly as an industry or as a sector as a whole.
Wonderful. Any parting words,
I'm going to go in a
Melissa?
totally different direction.
Okay. Okay.
Because when you talk about media and digital media is everything now because we're being served everything digital, whether it's video, social, everything is digital media. We have to figure out how we can work with policy and government to ensure that we can shorten our messaging and make it far clearer and simpler for patients to understand. So much of what we do is incredibly long length creative, especially within the video space. And we talk a little bit about the drug, and then we spend so much time talking about the product information, the PI, and even in the digital space, we're required to do so. But how can we come together as an industry and say, we need to simplify this because the message has to truly come through, not all the scary things, because when you talk to people and patients about pharmaceutical advertising, a lot of them are deterred because there's just, oh, I saw the side effects and, and no one wants to talk about diarrhea or whatever it is, but which is usually like a side effect. But nonetheless, like, how do we figure out a way to simplify it and evangelize for a shorter message that can truly be about the product benefit and less about ensuring that they have access to all of these things that ideally they'll learn about once they have a conversation with their doctor. So totally different
Wonderful.
direction.
It's
Love
it's a much better one, I think.
Sorry.
Wonderful. Thank you so much, Melissa and Stephen, for
Thank you.
joining us.
Thank
And
you.
thank you, audience, for
Thank
your
you.
active participation.